Hi, I'd like to discuss with you a surgery that I had today that was removal of scar tissue from around a breast implant. And this is a common question that women will ask, how to prevent the scar tissue from forming. So, number one, the most important thing I think that prevents the formation of a scar around a breast implant is the position that the implant is placed in. Almost always, both silicone and saline implants should be placed under the muscle, because when they're placed on top of the muscle, there's a much higher incidence of scar tissue forming around the implant, making it hard over time. Sometimes a textured or rough surface implant may diminish that possibility a little, but in reality, when a person is going to react to the breast implant causing scar, under the muscle is much less likely than over the muscle. And also, all of the other cosmetic complications, which means anything that makes a breast implant look bad, happens more often in front of the muscle than behind the muscle. So ripples in implants are more common in front of the muscle because there's less tissue. Scar tissue, long-term sagging of the breast implants over time because they're only supported then by the skin when they're on top of the muscle. So if you're going to have breast implants and the surgeon is telling you that he's going to put them in front of the muscle, he needs to have a really good reason why he's doing it and why he's not doing it under the muscle. So almost all board certified plastic surgeons recommend under the muscle. What else can be done to correct or to prevent scar tissue? Well, meticulous surgical technique. So besides placing the implant on top of the muscle, the only other thing that can or is known to cause scar tissue is bleeding. So the surgery should be done very carefully with as little bleeding as possible. And in general, when you do the procedure, there should be less than maybe a teaspoon or so of bleeding actually, and almost no bruising after the surgery. So surgeon controlling the bleeding. Minimizing bacteria or contamination. So obviously this is all done sterilely. You're getting antibiotics preoperatively to prevent infections as well as post-op. And then trying to have the implant not touch the skin as much as possible is said maybe to diminish the formation of a capsule, because no one really knows why a capsule forms. What I think is that patients react to a foreign body, the implant, differently, and some are just predestined or predisposed to get a capsule. And in those people, again, if you place it under the muscle, they're maybe less likely to. Some people would say that you could use steroids or actually an asthma medication afterwards if you think a capsule is developing. But I think that prevention of the capsule is the best method, and placing it under the muscle is the way to try to do that. Once the capsule forms, it's very hard to permanently correct. What I had done this morning was I had a patient who had a breast implant many years ago, and over time developed a capsule on only one side, which is also an interesting phenomenon in that most people who have a late formation of a capsule only happens on one side. And so with this surgery, you remove the entire scar and then place the implant again in the pocket, hoping that it will not recur. So prevention of the capsule, placing it under the muscle is the best place or the best option. So don't have your implant placed in front of the muscle.